City Views. City Views. City Views. You got love for your city? City Views. 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 And good evening. Welcome to City Views. My name is Jacques Williams, and I am your host. This is my co-host, Mr. Wilbur Bowles, also known as Weebo.
I'm here.
And unfortunately tonight, our lovely and talented co-host, the one and only Miss Melissa Crofts, will not be in the house with us this evening. But we're wishing her the best.
Yeah.
And Melissa, we miss you. We always do.
You and
You're
Parker.
not here. Yeah.
She might be a Parker.
Yeah, that's true. That's true. But hopefully everything is well and good, and we'll see you back on the show next week. Man, 2 weeks have gone by.
I know it.
And it seems like a year.
2 weeks.
You know? Unfortunately, not unfortunately, but last week we had the elections. So they had alternative broadcasting for you. And the week before that, our main man, Doug, who does our production work here for us, was taking a little time off.
Time off.
Well-deserved
Yeah.
time off.
We gave permission to take time off.
Well, yes, we did. Yes, we did. But we're back, and we're happy to be back. And one of the reasons we're happy to be back is we're in the process of launching our website, and we've just released our YouTube channel. So you could subscribe to our YouTube channel at City Views -CT. Pretty simple. And you can catch all the episodes of City Views, and you can leave comments. You can talk to us about issues you'd like for us to bring up, questions about guests, whatever the case may be. We want to make sure that we keep in touch, literally.
Yeah.
So check that out. And also we want to do what we love to do here, and that's give some props to our sponsor, Toth Insurance Agency. Steve.
Thanks, Steve.
No doubt. Appreciate
you the man,
that.
Steve. You the man, buddy.
Doing it for us, making us look good.
Yeah.
You know? Also, we want to say thank you to Catherine Pezzi,
Thanks, Ken. Hi, Bill.
our administrative assistant. And she works so hard, and we just want to let her know how much we appreciate her. And Tracy Rowe, our new web designer now, is
Hi,
on
Tracy.
board,
Good job, Trace.
as always.
Yeah.
And Daniel, the video man,
The man himself.
that's right. He stays on it, don't he?
Oh, yeah.
I mean, I see Dan like hustling up and down the street, man, getting
all over the
gigs,
place.
man, you know?
I said, you want to ride Dan? Dan said, no, I'm walking, Weebo.
No.
It's okay.
You know, he works it off, you know? So we appreciate the whole crew and everything that they help us to do to keep the show up and running.
Yeah.
Now, I'm not sure about one of our segments tonight. Michelle will be calling in if her plane doesn't take off.
She say if she don't, she try and get Marie
Yes,
on.
yes. So hopefully one way or the other we'll have our normal call-in segment from Michelle or Marie in this case, whichever. They're both provide great interviews, so, you know, we can roll with it.
Yeah.
But we're just really, really thrilled about the launch of the YouTube channel, because now people who can't view the show on our Tuesday night spot can now check it out anytime they want. So we're really happy about that. And again, we want to give Dan big props for setting that up for us.
Good job, Dan.
And working so diligently to make it happen. Also, on our show tonight, I'm really, really happy to have Mel Brickman here from Health Markets
How you pronounce his name?
Agent. Mel Brickman.
Mel Brickman. Okay.
Come on, that can't be that difficult.
Mel Brickman.
It does have a certain ring to it, doesn't it? A little je ne sais quoi. So I can't wait to talk to Mel. And
I got a picture of somebody on there.
yeah, dude, he's everywhere.
Oh.
I mean, there's nowhere literally you can go in the northwest corner and not see Mel Brickman and Health Markets Insurance Agency.
Now I see him in person, live.
You know?
Yeah.
And people will be shocked. I mean, Mel's a cool dude. So people that might see his picture up all over the place and stuff, they might be saying to themselves, hey, he looks pretty cool. But now they can find out.
Find out.
They can get the real deal. So definitely looking forward to that. And this is a very timely, a very opportune time to have Mel on the show because the enrollment periods will be getting ready to start and whatnot. And Mel's got some pretty timely information for you that he wants to share with our viewing audience. So we're looking forward to that. Now, weekend in review. What's up?
What's up, bub?
I know you was out doing can't fool me, Weebo. You got that smile on. You're like, oh no, I was just sitting back watching the Giants play. Nah, you was up to more than that.
Yeah, I went to Cracker Barrel.
Oh, there you go.
Me and the wife went to Cracker Barrel. I placed down. It was busy.
Yeah.
It was busy.
Yeah.
I mean, you gotta get. The girl told us you gotta come down during the week is less people. I mean, 40 minutes wait, man.
Right.
But they get you out of there.
Right.
In and out of there. And then yesterday went to Cole Park to the
For
back.
Veterans Day
That was good. The
ceremony.
place was packed, man. Packed,
I heard about that.
Packed.
I heard about that.
Standing room, man. People
Yeah.
in the back, man, trying to get in.
Yeah.
Yeah.
How long was the ceremony?
Oh, like we had a couple hours.
It was?
Yeah.
Yeah. Well, that was, as always, one of the community events of the year that people look forward to.
Yeah.
Oh, it looks like Michelle's calling already.
Oh yeah.
Oh my goodness.
All right.
She's Johnny on the spot tonight.
Oh.
Man. So we're going to talk to Michelle here and see what she has going on for us.
I represented the camp today. Today's a camp, special camp. Represented Camp McColeman in New Hartford.
Right. Nice. Didn't I see something about one of your Cub Masters that just got an award or something?
Yeah, saved somebody's life.
Oh, really? Is that what it was?
It was adult.
Wow.
Yeah.
That's serious.
Yeah, it is.
Okay. Well, Doug is giving us the thumbs up. So
Thumbs up.
let's see what's cooking.
All right. Chicken.
Good evening, Michelle.
Good evening, and how are we this evening?
Well, we couldn't be any finer if we was living in North Carolina.
Yeah, you would. You'd be a little warmer.
Now, Michelle, you know that we've just launched our YouTube channel, so people now might be able to view the show that are outside the confines of New England. So
See, that's very exciting.
I think so. And one of the reasons why, obviously, we're excited about that is because we know that you will give our new viewers great insight as to how the institutions in our state are working, and that's why I thought it was very, very important to start this segment because obviously, as a state rep, you've served us very, very well, and
Thank you.
I think that once we can get the community involved in the actual underpinnings of how we can create better public policy, hopefully that will reflect in the higher viewership of our show. So, as always, we thank you for your contribution.
Well, thank you. And, and I think that, let's go one step further than that. Let's hope that by being able to, for people to view things just beyond the walls of, of our Torrington or our state, that gives people the opportunity to have a more holistic and open and honest conversation about how things are, not only in Connecticut, but across the United States.
Absolutely.
Because quite frankly, we can learn from other people as other people can learn from us.
Right, exactly. I think that's the balance that we're looking for, Michelle, because let's be honest, many states, cities, rural communities are facing the same issues and trying to figure out how they can best assess their resources to meet those challenges. And I can't tell you how much I appreciate what you and others like you do. Although sometimes you get a hard time, but it's a lot of work. And not only is it physical work that you have to do as far as making appearances and whatnot, but to actually study and read the proposed legislation, that's a critical part of the job that you have to commit yourself to on a regular basis.
Well, and I think that people don't realize, I mean, and some do obviously, but the difference between one word, a shall versus
exactly.
a may
when
you're crafting a piece of legislation truly makes a huge difference
yep.
in what the interpretation and the outcome could be.
Yep.
And so just the final, the little finite details do make a huge difference when we're talking about trying to craft important policy and holding people accountable that really are affecting the lives of our residents in the state of Connecticut and across the United States, by the way.
Yep. Weibo was just sharing with me yesterday's Veterans Day observance at Co Park. He said it was packed.
I had said that when I spoke. Obviously, truly an honor and a privilege to speak in front of our veterans and stand with them and recognize Veterans Day and all of the sacrifices that people make, families and members alone. But yesterday, I believe in all of the years that I've been attending a veterans ceremony, and far beyond the years I've been in office, this had to be the most impressive audience. And I had said that when I spoke. It was standing room only and out the door.
Yeah.
And, I just could not believe the amount of people that were there, and a true testament to not only our veterans, but our community's support of our veterans, I think is something that we really need to focus on. And not just yesterday, but each and every day. Correct.
Michelle, tell me if I'm, over, dramatizing the situation or not, but I sense this real kind of convergence of our sectors in the community coming together, our social services sector, our manufacturing sector, our arts and culture sector. Is that just something that I'm just, wanting to happen, or is that really, are the leaders in these sectors coming together in a way that can help Torrington get to the next level?
I do think it's something that you've always desired, and I think it's something that I've always desired, and that's how we met so many years ago.
Wait, hold on. I thought we met on the softball field.
Well, we met on the ball field, but that was about getting things together.
Swing at the bat. Huh?
I mean, it was important about bringing different organizations down to Fusionist Park and making sure the Twisters had good stuff going on.
That's true.
So, and that was community organization and and collaborating efforts. And I do believe that we see that. A couple weeks ago, Representative Horn and myself sat in a meeting at Lark. And, they're talking about the collaborative services that they're doing, across agencies, and not just within their own, and not just within Torrington, but the entire Northwest corner. And they're reaching out, not sticking with just the Lark agency itself, but they're partnering with local manufacturers and a variety of other businesses to give their Lark members, positions to be, members of society and to feel productive members of society. And quite frankly, people benefit on both sides of that. And so I think that that's a true impressive example as to what you're talking about and referring to. And I believe that as people realize that as much as unemployment rates might be down and people are back to work and things might be moving in certain areas, you still have to collaborate because we can't fight all over the same dollar. We have to share those dollars. And if we realize that we can share the dollars and share the services, our efforts go, so much further than just trying to keep it within one area. So I do believe that we're making some headways and some strides. Obviously, nothing moves as fast as we would like, especially in government. But at the end of the day, it is truly impressive what we do. And I think that also warrants a shout out to the fundraiser that was done, a week and a half ago for Paulie Samil and his battle with cancer. And
big shout out to P. Sam. Big shout out.
Yeah, I mean, I think that when you talk about a community that really gets behind their community members that are struggling, It is huge. So, I mean, absolutely huge. I believe they sold out of their tickets. Unfortunately, our daughter got married that weekend, so we weren't able to make it back. But I sent a message to Paulie, bought my tickets. But the fact that they sold out of tickets and they get behind a community member that has been giving back to his community and his family's been giving back, just awe-inspiring of what we can do when we put our minds to it.
Absolutely. I was fortunate enough this morning to be invited to kind of a sharing session of the collaboration between Charlotte Hungerford Hospital and Hartford Health. And they went over what they've accomplished over their affiliation over the last 23 months and kind of gave a little vision statement as to what they would like to see the collaboration produce in the future. And I thought that was so indicative of the kind of leadership that's coming to the forefront now in terms of being proactive and providing those remedies now for the long term. And
well, you also bring up a great point. It's something that I shared on my Facebook page. Charlotte Hungerford got an A rating in a hospital review. It is on my personal Facebook page, so if anybody is looking to find it, and I know that there's always been a little bit of, maybe some naysayers when it comes to Charlotte Hungerford. My children were born there. We go there, but they recognize that we needed to branch out, and you have a great board of directors and visionaries that are making decisions for our community, and recognizing that Charlotte Hungerford once again doesn't only service the members of the city of Torrington, but the whole entire region. So, the partnership, I think, is extremely important, and giving us the ability to branch out into different specialties that we might not have been able to draw to, I think is vitally important, and that, they are our largest employer in the city of Torrington. So I think that we need to recognize that by them taking a leap of faith and partnering with Hartford Hospital and trying to improve, the good things that were going on there to make them even better is something that there, again, has us, visionaries and moving forward.
Absolutely, absolutely. Well, Michelle, your leadership has been definitely outstanding in terms of your outreach efforts and bringing the community together and bringing us the pertinent information that we need so that we can make the decisions that we have to make on a daily basis for our families and for our communities. So as always, we give you big props, and we wish you safe travels on your trip.
Thank you. Actually, I'm at the airport, so I apologize if there was a lot of reverb in the background. I'm actually heading to D.C. I have been nominated to be a representative for the state of Connecticut for the Women in Government National Organization, and we have a conference this week. And that kind of teeters right on what we were just talking about, because the primary focus is healthcare, pharmaceutical costs, and how we can ensure to have a healthier community.
Well, the emphasis on health and wellness that is stemming up from the community has some grassroots legs to it. So
absolutely.
Keep us updated, bring us back the information, and hopefully you can share that with our viewing audience.
Yeah, I look forward to it, and we can actually talk about that next Tuesday when we have our conversation.
Awesome.
All right, you all have a great week.
You too, Michelle. Thanks, Michelle.
Thank you so much, and give your best to give my best to your family.
I will, but you might see him before I do.
Yeah. All right, have a safe trip.
All right, thanks everyone. Thank you.
Michelle.
Take care.
Bye-bye. What's cooking?
Yeah, she's busy.
Yeah, man.
She's busy. She's all over the place.
She's on top of it. I had an opportunity to stop by City Council meeting before I came here today.
Oh.
Yeah, and I was just sitting there and I was thinking, because the roots of the show, that the founder Tim Driscoll built the show on, stemmed from City Council, and want to congratulate all the winners in the election on November 5th for I think public safety, City Council, Constable, Selectmen, and
Board Ed.
Pardon me?
Board Ed.
And Board of Ed,
yeah.
Yes. So I think, I don't know, I thought it was a tough election because I saw, viable candidates on both sides of the aisle. So it was tough. And I know a lot of the people personally that were running, But I think we're on the verge of creating that environment where we can look past our partisan differences and focus on what's best for the community. And I think that the leadership currently is leading us in that direction, and hopefully we can continue that and make Torrington an all-American city again.
Yeah. We can do it.
Yeah.
Everybody can do it. It could be number one in the state.
Absolutely.
We put out, communication, that's all about.
That's right. That's it. Well, I don't know about you, man, but I'm ready to talk to my man, Mel.
How you put his name?
Mel Brickman.
Mel Brickman.
Remember that.
Mel Brickman.
You might need his consult
I do.
day. We have another caller coming in. So let's take this call now. And hopefully, let's see here. We still have, we'll take this call now, do another break, and then we'll bring Mel in. So let's see what we have here. Uh-oh. Let's see what we got here. Is that Mr. Botas?
That's me, my man. That's me, my man.
Oh, the man is there.
Hello, Ray.
That's me.
He's early too.
Yeah. Hey,
Yes.
we had a lot of ghosts in the seat tonight, didn't we?
Well, I mean, considering how cold it was outside, I got to be honest with you. I think this little breeze that came over kind of like put everybody in their place, okay? And I think for the most part, people said it'll be warmer for the next city council meeting that I'll attend.
Yeah, I guess so. But I thought that was pretty interesting to see that audience build right in there. It was a full house there.
It could have been worse.
Yeah. Well, I got a couple of comments.
Yes, sir.
I just listened to What's Cooking there, and I don't know. I think she's off the wall myself. And there's a lot of other ones that like to say it, but they don't want it, so I'm speaking for them. But we have a meeting every now and then ourselves with a crowd that we get together with, and What's Cooking is brought up, and it's not all what she says it is. I think it's just a lot of crap. I don't know. It's just not right. But anyhow, that's the comment I got to say. But I just listened to her speech there with you, but I'm not going to take any more of your time because I see the two chairs are empty.
Well,
so I'm going to see what else you got going. What else you got on the stage there?
Well, I think tonight's show you might definitely want to stay in tune because Mel Brickman from Health Markets Insurance Agency is going to be talking to us about the enrollment period and other various aspects of the health insurance industry that you might be able to take advantage of.
I'm going to sit here on my couch and check it out here.
You got your hot chocolate?
No, I got my tea.
Tea. What about some chicken?
I got some nice honey tea. I got a little sore throat tonight in the last couple of days, so I think a little hot tea with a little honey would do me good.
Oh, it will. It will.
Chicken soup.
Yeah. Well, maybe I'll say one for What's Cooking.
You didn't hear the fact that she had a very distinguished award?
Yeah.
I mean, that's someone from our area who's getting recognized nationally.
Yeah. But I don't know. I think there's a lot of fakeness going on in there with that situation with what she's got going and what she's got cooking.
Oh my goodness, yeah. Ray, you're something else, man.
Yeah, hey, I gotta keep the ball rolling, though. You know what it is? I'm not gonna give up. You know what I'm saying?
Well,
I gotta keep it rolling.
But you know what, Ray?
Yes, sir.
I think Michelle takes your criticisms and tries to relay that into effective legislation. I think
I think so, but she needs people like us to speak up and say what we got to say. It's on our chest and say the truth, not sugarcoat anything, you know. So I mean that's the name of the game here.
You're absolutely right, and I agree with you 100%.
Yeah. So, but she ain't showed me nothing yet. I think it's just a puppet on a string over there in Hartford. I don't know.
Well, how about we do an investigation?
Yeah. I'm still there. I'm investigating. Yeah.
Oh my goodness. Yeah. Well, right now I think the acting Secretary of State might be indisposed at the moment, so we'll have to maybe delay that investigation.
Yeah.
All right. We'll check on it later.
Okay, Ray.
All right.
Thank you.
Good night.
Thank you so much for calling in.
Watch your guests come on.
Okay, man.
All right. Thanks, Ray.
Got some good information coming at you.
Thank you.
You're welcome.
Thank you.
All right.
All right. Bye-bye.
Take care. Gotta love it.
Yeah.
Gotta love it. Let's get, if you can see, we have the Mel Brickman badges on.
Yeah, he got more hair than I got.
Yeah.
Face.
Well, he's got a lot more things than you have.
Yeah.
I can't believe you did that. Oh my goodness. Weibo is coming unhinged right before our eyes, ladies and gentlemen.
My giant hat too, you know.
Oh boy, yeah.
No
we didn't even talk about sports tonight.
No, not tonight.
Okay.
We got Mel tonight.
That's right.
Mel Brooks.
Okay. We're going to take a break now, and we're going to get ready for our special guest this evening, Mr. Mel Brickman. So you guys hold tight. We'll be right back right after this.
Shelters are the best places to find a new pet.
What a perfectly beautiful little lady.
That's where you'll discover healthy, loyal, and loving animals.
You little rascal.
Eager to become a part of your family. A person is the best thing to happen to a shelter pet.
Oh, ladies first.
Be that person. Adopt.
This is living. Hey, kid.
To find out more, visit theshelterpetproject.org.
A full life, measured in seats, starts with the right ones early on. Car crashes are the #1 killer of children 1 through 13. Learn how to prevent deaths and injuries by using the right car seat for your child's age and size.
I've always said that you can't change what you don't acknowledge. So let's acknowledge this. 1 in 6 Americans now struggle with hunger. These are our co-workers, our neighbors, our friends. The problem is closer than you think. But so is the solution. This is a changing day, not just in your life, but in the lives of many, many others. Join me by visiting feedingamerica.org and find your local food bank to help. I'm Dr. Phil, and together we're Feeding America.
You're on your way to meet up with friends, but you can't seem to get anywhere quickly. You don't want your friends to be annoyed, so you text. You're on your way. 5 seconds is the average time your eyes are off the road while texting while driving. Make sure you get where you're going.
And we're back, ladies and gentlemen, with special guest this evening, Mr. Mel Brickman from Health Markets Insurance Agency. And my friend and colleague, better call Mel.
Yeah.
Better call Mel.
Better call Mel.
Thank you.
Is Brooks
Thank
or
you.
Mel?
Whatever.
Okay,
Just remember the number.
okay.
Remember. Hey,
You have to excuse Weibo. Sometimes he gets a little giddy.
well, listen, I understand his hair is a little out of control.
Yeah.
And,
Hard time sleeping too.
yeah.
On my face.
Got things on your mind?
Yeah.
You like to tell us about it?
Chicken.
Jeez.
Oh my goodness! I think him and Dan are going to hook up after the show and do a Chinese chicken.
Chinese chicken.
Yeah.
Every Tuesday, that's Dan That's his date right there.
Oh boy, off the chain. Nonetheless, Mel, thank you for joining us tonight, man.
Glad to be here.
And if anyone who lives in the Torrington, Litchfield County area hasn't seen this man's face on a billboard somewhere near you, I think you've been hibernating for the last, 6 weeks?
For the last 6 weeks.
I've been counting.
Well, you're doing a good job.
Thank you.
Thank you.
But Mel, the reason why I wanted you to be on the show tonight is because we're coming up on a crucial period.
We're in it.
In your industry right now.
We're in it.
Yes. And I wanted you to address our audience and talk to them about some of the options that might be available to them.
Sure.
And, especially for Ray, since he's still watching.
I hope you're feeling better, Ray.
So please let us know what's going on with the enrollment.
Sure, happy to. It is open enrollment period, and as you know, people both under 65 and over 65 have to make some choices about what kind of medical care they're going to get. For those of us on Medicare, it's harder than ever to make an intelligent choice. There's more and more advertising coming in and mailers and promises that every plan is the best one possible. Frankly, I spend a lot of time just helping people sort through the promises because not everyone is the best, and it's a year-long process for someone like me to determine what is the best for the people I'm working with, and so that's the kind of service I offer, and that's what I've always done is help people understand whatever the concepts are that I'm dealing in. Yeah.
Well, health insurance is very difficult.
It is complex. It probably is the second most important financial subject people will be faced with these days. The purchase of a home, maybe first. Car used to be second, but now it's insurance. And a poor choice there could result in a lifetime of bills and financial ruin. So, got to understand the language and the reason to choose something.
Now, when I was going into insurance a few years ago, one of the reasons that prompted me to do so was because I felt like, especially with the Affordable Care Act, that the individual markets were just going to explode. But they didn't.
They exploded, but...
well, put it like this. It wasn't profitable enough on the agent side for the work that you had to do and the processing of the whole thing. But talk to us about the individual markets and how that plays into the insurance landscape today.
Of course. As you know, there's an under 65 market, and folks who do not get their coverage through their workplace buy coverage. And the intention of the Affordable Care Act was to make insurance available to more people. First, those people that couldn't afford to pay. The expansion of Medicaid was a part of the Affordable Care Act. And it did ensure that the emergency room wasn't crowded with folks who really should have been in a doctor's office. And then folks who are working and earning a good wage still found that their insurance costs were too high. And the government brought some money to bear to the insurance companies to say, okay, we're going to allow some increase in rates, and we're going to help people pay for their coverage. And that has worked, though it's been a convoluted process.
I was getting ready to say, because
it has.
From a practical basis, when you're explaining that to someone, they might think to themselves, well, that's a canary chasing the coal mine. I mean, you're going to increase rates, but then the government's going to pay for it. Then, where does the large numbers concept come into this? Because somebody's got to pay that.
Okay. Well, of course, in the early days, it was expected that those folks who didn't need a lot of medical care would be on board and pay their fair share. But folks who didn't need medical care just didn't enroll. Penalties or not. So the concept was not well thought out in that there wasn't the money there from the beginning. Right. So government steps in when there isn't money there, even if it doesn't have it. But you got to understand.
The intent was right?
Yeah. But you have to understand that the growth in costs over the past few years have been much slower and lower.
Right.
And this has been because folks who were never going into a medical office are now maintaining some wellness.
Right.
And you had talked earlier to Michelle about this concept that wellness is what is really driving our future.
Yes.
And as people do pay attention to that, our costs go down. Now, the fact that more care happens and it costs more money, that's a different part of this. Mm-hmm. I mean, folks who are living now who were dead from what they had 15 years ago.
Right, exactly.
Stage 3 and 4 is something to live with, not die from.
Right.
And so that does cost money too.
Right. Well, that's I think the big conundrum that that our legislators are facing, and that inconsistency in deliverables. How do you break that down when you're talking to a client? You're looking at their financial situation, their budget, and whatnot.
Yeah.
What red flags do you look for in order to help them meet their challenges?
Well, the first part of the conversation, Jacques, is how do you use medical care?
Right.
And though you may have been used to going to a doctor and having a copay, the real question is, do you need to do that? If you don't use care all that often, well, then you shouldn't be paying for something you're not using. Mm-hmm. And when people understand this metallic plans and silver, bronze, gold, when they get an idea of what each of those plans give them versus what it costs them, they're more willing to back down a little bit and say, well, geez, I don't really want to go to the doctor anyway, so I don't know why I'm expecting to have a copay. And it's this languaging, and my point to people is it may not be one that would be appreciated at all times, but the medical care is a business, and the business of medicine has become driven by the insurance company and by the pharmaceutical, and the government happens to be in that business as well. It's in that conversation as well with those funds that you so broadly point out aren't available, but they are in the mix.
Right.
They are in the mix,
right.
And so I help people understand how a plan works and what would be best for them.
Now, do you work directly with providers?
No.
Okay.
I don't work with providers. I am an independent licensed broker, and I help people enroll in plans, and I'm paid by those plans.
Right.
I don't have a favorite.
Right.
But what I do is I make sure that people understand who they can see and what it will cost them to see somebody and what it will cost them not to see somebody. So it's this understanding, it's this education.
But in that educational process, philosophically, that stems from somewhere. And when you have a situation where, for example, when you expand Medicare, that's based off a philosophy that everyone should have insurance. So philosophically, what is your stance on that? I mean, I'm sure that you would probably tend to lean toward that side, just on a humanitarian basis. But how do you think better legislation can be produced philosophically through the lens of providing health care for everyone?
Legislation. Talk to Michelle about legislation. Well, listen. All right. So the question is, how do I lean in terms of Medicare for all?
Well, I'm just saying.
Not at all. By the way.
Okay.
I think that's an airy-fairy concept.
Okay.
I believe that people are entitled to have health care.
Right. Right.
Although I don't think that the government is the delivery system.
Exact. That's
Medicare, in all of its goodness, has its flaws as well.
Right.
And so I think that it's important to improve upon what has been rolled out through the Affordable Care Act, because that has some very fine elements. And I think that is the way that more people will be covered and less people will be sick, because there's a wellness component. I'm not in favor necessarily of this Medicare for all world, in which the government is delivering service.
Right.
No thanks.
Right. Well, that's what I was getting to, because I think it's very, very important that choice plays a role.
Paramount. And as a matter of fact, our country was built on people having a choice. They came here and they founded their communities, and they have freedoms to live a certain way. And so for the government to be taking over another option doesn't sit well. And I can see how people would be upset about that.
Right.
It's against our grain.
Yeah, totally is.
Right.
Now, what plans does the government endorse in terms of how it favors tax status to people who might be in the health insurance market?
You translate that for me?
What are the qualified plans for that people can take advantage of that will give them tax advantages?
Well, when the Affordable Care Act rolled out, there were 10 essential elements built in, and insurers were required to offer these things. Now, there are plans, and there have been plans that don't have all of those essential elements. Maybe expanded mental health, not. Maternity care, not. So plans like that are not available in Connecticut, and they're not supported by tax dollars. Connecticut, though, has gone a step further and made it difficult for people to even get a short-term plan, because short-term plans in other parts of the country are pretty standardized. They're standard fare. They are medically underwritten, and a carrier can choose whether or not to issue that plan and for how long. Our own legislature has really put the squash on that by requiring those short-term providers to treat everybody the same and not medically underwrite. Well, that kind of took the product away from our citizens. Not a good thing. A lot of people have lost out because of that change, frankly. So from a legislative standpoint, our folks ought to take another look at allowing short-term plans, allowing folks to actually buy what they want. And if they're eligible based on their health, they should be able to have them.
I agree.
Again, freedoms have been removed here in Connecticut that exist in other places.
Well, that is one of the criticisms about the state of Connecticut in terms of some of its administrative services that tend to be resembling the dinosaur age. But that's a topic for another day. I'm curious, though, because as we go forward, as we move forward, as our population, and especially one of the data points that we have in our particular area is that we're getting older.
Yeah, I noticed. I looked in the mirror this morning.
You're not getting older.
No.
But the general population is getting older.
Listen, my friend told me that when he saw my face on the billboard and saw me in person, he said I looked worse in person. So I knew that I was getting older.
I disagree with him wholeheartedly.
Thank you very much. and I like your badge.
No, well, wait a minute, because when we first met to talk about the show and whatnot, when you told me, you revealed to me what your age was, I was rather shocked. So you're doing good, and it's a good thing that someone who administers health insurance coverage looks healthy. Yeah. I mean, that's a good testament. It's like the dude must know something.
Well, just like when doctors stopped smoking, it was a good thing in their offices. Just saying.
Wow, that just blows my mind.
It wasn't that long ago that it was happening, Bell.
In restaurants too, it's like crazy. But we're going to prepare to take a quick break, if Doug is around, and then we're going to come back and talk a little bit more with our guest this evening, Mr. Mel Brickman, who I'm so very honored to have in the house tonight.
Thanks.
As
Pleasure
part
to
of
be
our
here.
Leads group from the Chamber of Commerce.
An excellent group, by the
An
way.
excellent group,
Yeah.
indeed. And so let's talk a little bit more of that in the next segment.
All right.
Okay?
All right, sounds
so
good.
you guys stay tuned, and we'll be back with more. You do have the phone lines up, and if you want to make a call, please feel to reach out to us. Got about 15 more minutes. Okay? We'll be right back.
Viking,
Red state, blue state, vegan,
carnivore.
We come from different places.
Uptown,
downtown,
optimist, cynic.
We come to different conclusions.
Half empty.
half full.
But when we live united, we create real, lasting change in the building blocks of life. The education, income, and health of our communities,
Live
our families,
united.
even the person next to us.
Live united.
Real change won't happen without you. So give, advocate, volunteer, live united. Sign up at liveunited.org.
The pain will not control us. It will never break us, define us, or keep us still. Because arthritis can't beat us if we beat it first. In the fight against arthritis, you need a weapon. What's yours? Visit the Arthritis Foundation at fightarthritispain.org.
Welcome to Fogel's.
Beautiful, isn't it?
You expect options everywhere else. Why not with your medical treatment? Talk with your doctor to explore all your options and find what's right for you. Visit ahrq.gov.
Getting closer to nature can get you closer to your family. Go to discovertheforest.org.
And we're back, ladies and gentlemen, with our special
Here
guest
we
in the
go.
house tonight, Mr. Mel Brickman.
Hello, everybody.
From Health Markets Insurance. Thank you, Mel, for joining us tonight.
You're welcome. Glad to be here.
And I hope this is as much of an edifying conversation to our audience than it is for me.
Well, thanks, Jock. As a matter of fact, people have plenty of questions about health insurance, and I encourage calls. Let's just have a little dialogue about how these things work and what's the best way to go about it, because the only way you know is by talking about it.
Better call Mel.
Better call Mel. That's it.
Now, one of the reasons that I think this conversation is important is because younger people who we want to start getting the message out to, which is why we're doing the YouTube channel now. We want to get the word out to them so that they can start making choices earlier in their lives as to how they want to set up their financial nest egg going forward. For a young person, say a single female, 25 years old, wants to talk to you about steps that she might want to take to not only develop her pathway to health and wellness, but also to take advantage of things that might make her have better financial decisions in the future. How can a health plan work into that?
Good that you would ask. When I talk with young people who are coming off their family's plans, first mom and dad say, I'm going to come in with my kid. No, I'd rather you didn't, because your son or daughter wants to learn about this or needs to learn about this without your help, because they're going to be living for a long time under their choices. And so what I explain to them is that if you're serious about controlling your finances, you buy a plan that's HSA compatible. So this conversation surrounds what's an HSA, what most adults don't know what an HSA is. And so a health plan that does not put out money for you, but just negotiates your prices and lets you put money aside pre-tax into a savings account is really the best way to go, because one learns to put money aside for when one needs it, not just spending it.
Right.
So that's really the beginning part of this conversation.
And isn't that kind of where things are going ultimately?
Well, they're going that way because the plan deductibles are becoming so high that people aren't getting, they're not getting help paying for things anyway. So I encourage them to take a plan that lets them put money aside pre-tax.
Right. We have the old chief calling in, Sam Slaby.
Oh, Sam.
Yeah.
Sam's been on. Sam was a post.
Yeah, let's see what Sam's got to say this evening. Mr. Slaby.
How you doing?
Good evening, sir. It's nice to hear from you.
Well, I'd like to welcome Mel to City Views, and I think the conversation you're having is a really important one, because health care, I believe, is the number one issue on a lot of people's minds. I've done a lot of bankruptcy practice, and it used to be that credit cards were the number one problem with bankruptcy. But now, I found out this weekend, I knew it was always high, but now apparently health care bills are the number one cause for people to file bankruptcy.
Yeah.
I disagree with Mel in one aspect. I really believe that ultimately, even though I don't think it's going to happen anytime in the near future, that the Medicare system is a model we should look at. People who I know on Medicare have choice of what doctors they want to go to.
Oh, sure.
If you take advantage of Part B of Medicare, which is fairly affordable, much more affordable than a lot of these private programs where you have to have a $6,000 deductible, you get more coverage. And then there are people who also can buy, if they choose, policies that cover things that Part B doesn't. To me, that's a sensible system. For people, especially people who are not used to dealing with insurance bureaucracies, to have to make a lot of these complex decisions. And, Mel's correct, these decisions are very complex, and you need a consultant like Mel to make a lot of these decisions.
Right.
And, people shouldn't have to decide, do I want to buy enough groceries this week, or do I want to buy the necessary medicines or go to see a doctor to see what's wrong with me? That's not a decision people living in a civilized society should have to make. And we're the only industrialized, modern, in quotation mark, society in the Western world that does that. Just about every other country has a system where people don't have to worry about bankruptcy. They don't have to worry about where their next meal come from to get adequate medical services. But I think right now the Affordable
Care
Act is not perfect. It certainly can use some improvements, but it's something to build upon. But I think the goal ought to be to get on a system like Medicare.
Well, Sam, just to clarify, I think Medicare for All is a false term because people don't understand really what Medicare is. And the point is that folks on Medicare do have choices. However, their choices aren't the same as the kinds of choices people under 65 make. So what those folks, I believe Medicare for All is the government being the single payer for all claims. And that is not the way Medicare works at all.
But Mel, it's not the government that's paying. It's the people who pay into the program that are paying. The government is the agency that spends the money that you put into it. So the issue is, and of course, Medicare costs have to be controlled. I mean, the costs we pay in this country for medical insurance is outrageous. And so it's a twofold thing. It's not just the expense, it's the cost.
Yeah.
But again, people should not have to be making decisions. I don't care what age they are, life or death, based upon how much money they make. And certainly people with pre-existing conditions shouldn't have to be concerned that because I was born with a gene that's not compatible with good health, I should just face the fact that I have to live a short life and an unhealthy one.
True.
Because I can't afford insurance.
Wow.
Yeah.
Well, I think it's a blessing to be able to have the type of community that we have, Sam, where we can start bringing these issues to the forefront and start providing some viable solutions so that we can create a model here in our community that hopefully we can maybe share with other communities that might have similar challenges.
Before I go, I just want to say, it's a shame that a lot of these issues, like health, have to be so bipartisan in their discussion.
Right.
Mm-hmm.
Why can't we have a pragmatic discussion? Try to do something that's practical for everybody.
Right.
There's room for discussion on this, but healthcare, like many other issues now, has become so polarized, and people make statements that, on both sides, that can't be backed up, that are not thought through, and are influenced by whatever their political bias happens to be. That's nonsense.
It is.
But at any rate, I'm going to let you guys go. I've vented my spleen enough tonight.
Thanks.
Sam, thank you so
Sam.
much. We appreciate it.
And hope your spleen feels better.
Yes. Well, we're going to have you back in April.
Yeah.
Whenever you like.
When's the next enrollment period?
Happy to be here. Well, the next enrollment period is next year, but
I thought they had.
No.
Okay.
Let's say this. People are always faced with these choices because they age into Medicare all the time. 10,000 people a day.
Wow.
Are still turning 65, and my phone's ringing more from those people who say, gee, I got more stuff in the mail that I don't understand. So we can talk about this at any time, and we can center a show around just Medicare if you'd like.
Great, we'll do that.
Great.
Dan, put it down on your calendar, and we'll go visit Mel in his office and take an interview on him.
Oh, I got to clean things up, huh?
Yeah, you do.
All right.
You better clean it up.
All right.
Before we go, though, I just want to let you guys know that the Rally to End Homelessness and Hunger will be taking place Saturday, November 23rd. It's the 5th annual, and there's a scheduled event here that we're going to have Deirdre on here soon, hopefully, and she can help us out with that. But if you want more information on that, just call 860-482-7300, or you can go online at www.fishnwct.org/pasta lunch. That's www.fishnwct.org/pasta lunch. Or again, you can call 860-482-7300. Once again, Mel, thank you so much, man.
Jack,
it's been a pleasure.
And you better call Mel.
Call Mel.
Call Mel.
Thank you.
You the man, Mel.
Yep.
God bless you, man.
Thanks.
In the meantime,
Nice to
we'll
have
be
you.
back next week. You know the dealio. Tell all your friends and neighbors to catch us right here on City Views, or go to our new YouTube channel at cityviews.ct. I guess that's it. We'll see you next week. Thank you.
About that time. City Views. What's happening in your city? City Views. You got love for your city? City Views.